Module 5. Parliaments and Parliamentarians as Advocates and Leaders. Parliamentarians are representatives. Representing the people of their constituency is a fundamental responsibility. Representation takes many forms, and the work of oversight and lawmaking has already been discussed. This section considers the other opportunities for parliamentarians to act as advocates and leaders, and how this function can be leveraged to support health emergency preparedness and health security. It is the role of parliamentarians to connect with people within their constituency and to communicate and introduce matters of national concern into the national debate for decision making. Parliamentarians are community leaders and often have influence and standing outside Parliament. They also connect with interest groups, civil society and the local government. Parliamentarians can play a role in ensuring communities are resilient and ready well before a low-level or serious risk emerges. They can communicate regularly with their community and with locally based health workers to remain apprised of community health issues and priorities. They may build coalitions with faith-based or community-based organisations, non-governmental organisations and private sector organisations to facilitate partnerships or simply keep abreast of who has the expertise and skills that may be of central importance when a crisis hits. When there is a localised health risk, parliamentarians may play a leadership role in helping communities accept, understand and address the risk. This can be done, for example, by getting vaccinated or having their children vaccinated during a measles outbreak, or by adopting lower risk hygiene-related behaviour if confronted with cholera or COVID-19. Preparedness addresses low-level risks as well as preventing them from escalating and becoming national or international emergencies. Addressing low-level risk is one of the core capacities under the IHR. During health emergencies, including SARS, MERS, Ebola, cholera and COVID-19, it is important for parliamentarians to have access to up-to-date, science-based data. Parliamentarians can act within their constituencies to inform, explain, reassure, assist and advocate. However, their activities may be hampered by restrictions on movement or by other responsibilities, which may be the case for parliamentarians holding related ministerial portfolios. Part of preparedness is ensuring access to information. This may be from the Ministry of Health or another source of data within the country. Some preliminary considerations. Where can I find information drawing on hard sciences and the latest country data? And how can I continue to receive updates? When there is a local health risk of any level or a national or international health emergency, what are the specific risks for my constituents? For example, patterns of tradition, patterns of transmission of a communicable disease, risks arising from living arrangements, demographic mix, geographical challenges in terms of distance from health facilities, local availability of health practitioners, etc. How well are messages about risk management, disease transmission and actions people should take to protect themselves and their families being received in my constituency? Is there anything preventing my constituency from receiving information such as language issues, illiteracy, lack of access to electronic media or written material, or cultural issues? Is there anything preventing my constituency from accessing available treatments? For example, are the cultural or religious reasons why a female health worker would be preferred when it comes to providing treatment, information or vaccines? And are such workers available? What support and assistance are being provided to address a health emergency? And are my constituents able to access them? Is this support and assistance gender sensitive? Can I advocate for my constituents to get improved access to information and other resources such as health workers, vaccines, drugs and protective equipment? Some options for parliamentary action. Seek updated information based on the latest data and science to stay abreast of the progress of any health risk. Seek briefings and updates as necessary from the competent authorities and involve subnational leaders and authorities with responsibility for health risks in your constituency. Maximise communication opportunities for meeting with constituents during health emergencies by using electronic platforms such as Zoom and WhatsApp. Work with civil society organisations to promote important issues. Actively get to know and ensure you are able to tap into diverse networks within your community and ensure they have access to consistent and trusted source of information throughout the emergency. address misleading information and fake news by facilitating links between the national and subnational levels and using updated and science-backed information. Either travel to the constituency or make sure it is visited by people who can provide information. For example, a minister may not be able to leave the capital but can send staffers. Take every opportunity to listen to what constituents are saying and see what they are doing. This information can be relayed back to the authorities so that they know if people are getting the right messages and assistance. If there are particular concerns in your constituency, communicate with the competent authorities in order to address them. Help people accept measures, in part by modelling acceptance of, for example, COVID-19 safe practices such as social distancing, mask wearing, hand washing and using hand sanitizer. Help connect constituents with particular problems to relevant ministries in order to find assistance, such as in getting family members home from other countries. Explain the potential impact of health risk, for example, the fact that Ramadan cannot be observed in the same way when there is a pandemic. Link the government with the community. Let's recap what we have learned. Parliamentarians act as advocates and leaders and support emergency preparedness and health security. It is the role of parliamentarians to connect with people within their constituency and to communicate and introduce matters of local concern into the national debate for decision making. Parliamentarians can play a role in ensuring communities are resilient and ready well before a low-level or serious risk emerges. They can communicate regularly with their community and with locally based health workers in order to remain apprised of community health issues and priorities. During health emergencies, it is important for parliamentarians to have access to up-to-date science-based data. Parliamentarians can act within their constituencies to inform, explain, reassure, assist and advocate. Here is a question you can ponder over. Which are the various roles parliamentarians can play to advance health emergency preparedness and health security within their communities and constituencies?